Hello, everyone. I am Dr. Prakash. I hope all of you are coping well and doing well. I am privileged to be invited to be a speaker for this forum that is held in conjunction with the World Parkinson's Awareness Month. And my talk today is titled Parkinson's Disease Across the Spectrum. This is the outline of my talk today. I will briefly introduce what Parkinson's disease is. Subsequently, we will talk about motor as well as non-motor symptoms of Parkinson's disease. And then we will talk about progression of Parkinson's symptoms. And finally, a brief outline of how Parkinson's is managed. These are pictures of people who have or had Parkinson's. So that's the late Pope, Hitler, President Deng, Muhammad Ali, as well as Michael J. Fox. So what is Parkinson's disease? It's a condition with progressive brain cell destruction, or also called neurodegeneration. We believe that the brain cell destruction starts at the brain stem level, and then subsequently the destruction continues upwards to other structures of the brain. And then finally, in advanced stages, it affects the whole brain. So as a result of that, the brain cells which produces brain chemicals, or also called neurotransmitters, become less and less productive, particularly of dopamine secretion. And as a result of that, patients develop symptoms. Now, they generally develop it slowly over years or even decades. And the symptoms are mainly motor symptoms, or what we call as movement-related symptoms, as well as non-motor symptoms. Now, the cause of Parkinson's disease is largely unknown, but the current hypothesis is probably it's an interlink between genetic factors as well as environmental factors. How common is Parkinson's disease? Well, about 3 out of every 1,000 people above the age of 50 years would have Parkinson's disease. And it's one of the most common neurodegenerative condition. Roughly, age of onset is in the early or mid-60s. As far as the incidence and prevalence is concerned, it basically increases with age, and the phenomenon is similar worldwide. There is no difference in terms of prevalence rates between different ethnic groups. And if you look at my chart here, which illustrates the age, as you age, you will have higher incidence and prevalence of Parkinson's. And generally, males are more affected than females. So what are the motor symptoms? Firstly, it's stiffness, and it's not just affecting the muscles of limbs, but muscles of other areas as well. In general, it's painful and may limit movements. Patients also often complain of tremors, and these are mainly rest tremors. Initially, they may have tremors of hands or fingers, or even toes. And later on, it can progress, affecting the other areas as well. Sometimes patients with Parkinson's also have lower jaw tremors. Commonly also, they complain that they are slow in doing their day-to-day task. When they walk slowly, they make small steps, and they turn with small steps. They have also difficulty getting in and out of bed sometimes. When they walk, they are seen to be more stooped, or sometimes even leaning towards one side. And as the disease progresses, they would have poor balance, they would have falls, and they would also experience intermittent freezing of gait. Patients with Parkinson's also oftentimes they complain of problems talking. Initially, it's softer volume, speech is monotonous, and later on, people have difficulty understanding them because their voice is quite kind of muffled, and they would also have lots of hesitation to say a word or a sentence. If you look at their handwriting, they would have progressive, smallish handwriting over time, and sometimes it becomes illegible also. As far as non-motor symptoms, there is a whole array of non-motor symptoms, which includes urinary problems, particularly frequent urination at night. Sometimes they would have incontinence or dribbling. Constipation is very common. Either it's less frequent bowel openings or takes longer time to pass out the bowels, needing strains, or even sometimes requiring some medications, suppositories and enemas. Pain is also common, and these are not just aches and other types of pain, but also may be related to the stiffness that patients have. Patients also complain of having swallowing problems, and this becomes even much more difficult as the disease progresses, not just swallowing of liquids, but also solids. They would also have problems with saliva. It's not because of overproduction of saliva, but simply because they have or they have lost the automatic swallowing capacity. Normal people like us would generally, before we open our mouth, we will actually swallow salivas. But this automatic movement or habit of swallowing is lost in patients with Parkinson's, and therefore they would be seen as drooling. Patients also can have sudden either excessive sweating or sudden feeling of coldness or chills, and in most cases it's related to medication off timings. Other non-motor symptoms include low blood pressure. This is particularly when patients are upright or getting up, and what they feel is because of lowish blood pressure when they are upright, they'll feel dizzy or faint, and sometimes these can be so significant that they sometimes would fall. Patients also would complain of low energy, particularly they will feel tired, they will feel sleepy in the daytime, and the opposite in the nighttime, where they have difficulty going to sleep or having interrupted sleep. Patients with Parkinson's also generally have problems with their sense of smell, and this can sometimes predate the symptoms of slowness and tremors and so on. As disease progresses, patients also would have problems with their memory, as well as behavioral problems, which includes hallucinations, delusion, as well as anxiety, depression, as well as lack of motivation, or also called apathy. Now, patients of Parkinson's, in the beginning, usually they would have symptoms on one side, and that's what we call as stage 1. But over time, they would then have problems affecting the other side as well, and that's when we call it stage 2. And then when it starts to affect their balance, we call as stage 3. And when the balance is significantly more affected, when they require assistive devices or somebody to hold them, that's about stage 4. And finally, stage 5 is when they completely can't stand and walk. They are more or less wheelchair bound or bed bound. It's important to emphasize that the symptoms which an individual experience varies from person to person. And also sometimes within that same person, the symptoms can vary from day to day, hour to hour, and in more advanced cases, it can vary from minute to minute as well. So it's not a life-threatening condition, but certainly a life-altering condition. And the symptoms that patient would have definitely and significantly can affect patients' quality of life. And so how is Parkinson's disease diagnosed? So physicians like me basically rely on the neurological examinations as well as patient's description of symptoms to determine whether he or she has Parkinson's. And sometimes they would order some tests, not so much to confirm the diagnosis, but to exclude other rare conditions which sometimes can mimic the early Parkinson's signs. And in some cases, the diagnosis of Parkinson may not be clear in the first few visits and only become more and more apparent in subsequent visits when patients continue to progress in their condition. Now, how is Parkinson's disease treated? Well, it's sad to say that there is no cure for this condition, but there is various forms of treatment available nowadays to try to improve patients' symptoms so that their quality of life is somewhat maintained or not badly affected, and they can carry on with their day-to-day function as normal as possible. The other thing I need to emphasize is Parkinson's disease is cared not just by a single doctor, but a team of multidisciplinary members of healthcare providers. And as you can see here, the team which I have here is heavily involved in caring for a single patient with Parkinson's. Okay, the treatment basically involves non-medication therapies, which is very important, particularly in advanced conditions. That includes physiotherapy, occupational therapy, speech therapy, and various forms of other therapies. Also, the various types of medications, and in some patients who do fulfill the criteria, we also send them for deep brain stimulation. Now, a lot of you will be familiar with these medications that Parkinson's patients have. Broadly, we divide it into levodopa-containing medications as well as levodopa-sparing medications. And so levodopa-containing medication includes Madopa, the various formulation, Sinemet, various formulation, and the newer ones, which also called Stalevo. As far as levodopa-sparing agents, you could see the whole lot of dopamine agonist medications from the old Trivastal or Peribedil to other newer ones, which are called pramipexole, ropinirole, or the latest one on the block, which is the patch form called rotigotine. Other medications include selegiline, trioxyphenadil, as well as amantadine. Now, in the initial period or early part of Parkinson's disease, whatever medications and however low the medications, however low dose the medication is, it all gives benefit to the patient. But over time, as the disease progresses and more brain cell disruptions continue, patients lose the benefit they used to get from the low dose medications. And as a result of that, medication dosage as well as frequency need to be increased. And the reason is because patients develop short-lasting effect of the medications, and as a result of that, they would have fluctuations from being on to off to having significant dyskinesia. Initially, the fluctuations are predictable, but as the disease progresses to advanced stages, it becomes more and more unpredictable. So sometimes even when you have taken medications, you don't feel the benefit of that particular medication, or you would have the medication effect coming in very late, or sometimes even short-lasting medication effect. All right, so what we mean by levodopa-related fluctuations as dyskinesia, firstly, we talk about on, which is in general good timing for patients. That means the medication is working and patients are able to perform their day-to-day function with relative ease, more quickly and less stiff. And then there is this off state where medications has lost the effect, and that's usually bad time for patients, and they complain of some difficulty in their day-to-day function and more slowing and more stiffness. So here's a video of a patient with fluctuations. So this is when the medication effect has worn off. He cannot actually get up from his chair. He needs assistance to get up. And when the medication's effect takes effect, he's quite independent, able to walk, although it's stoop posture. All right, so that's the fluctuation from on and off. The other thing is that dyskinesia. So sometimes patients would develop too much medication in their system and they would develop this involuntary jerky, irregular swinging movements, sometimes can be referred as dance-like movement, or some even say clumsy-like movement. So like in this video here, the patient is having this involuntary excessive movements of the limbs while he's trying to get up, as well as while he's trying to walk. And sometimes it can affect the patient's function, as you can see from here. Now, the other thing which patients also regularly complain when they have fluctuations is dystonia, which is basically involuntary posturing of their limbs or spine. And sometimes this can be painful, and in most cases related to medication off time. So how do you manage motor fluctuation and dyskinesias? As far as patients are concerned, it's very important for them to keep the timing of medications accurately. And the reason is because if the medications is given too close to each other, then you would have excessive medication effect within the body, and you may have increased side effects, all right, from the medications, including dyskinesias. The other hand, if the medication dosage is too small or too far apart, then you would have short-lasting effect of the medications, and you would have more off symptoms. And one other important thing, particularly in advanced Parkinson's, is to keep the medication timing away from meal timing, because meals which contains protein would significantly affect the medication's absorption, and therefore the medication's effect would be substantially reduced or in fact completely lost also. The other thing about Parkinson's disease managing fluctuations includes keeping a proper Parkinson's disease diary, which basically helps you to understand, and more so your healthcare provider, doctors, and so on, to understand how you are fluctuating from hour to hour. As you can see on this paper and pen illustration here, we are trying to monitor at different hours where the patient is on, off, or having dyskinesia. And the patient also can add some comments here, whether they have just taken the medications, or whether they had bad offs, or whether they had falls, and so on and so forth. In the recent time, we have also come up with this Parkinson's app, with just almost similar things like tracking the symptoms of Parkinson's when they are on and when they are off and when they're having dyskinesia. So this app is now in your Health Buddy also. Next, we talk about deep brain stimulation. So what is deep brain stimulation? It's actually a treatment involving chronic electrical stimulation of the deep structures of the brain. And somehow with this chronic electrical stimulation, it alleviates some of the symptoms of Parkinson's. So it basically contains a battery device like this, which is placed under the skin, under the collarbone. And then he has got this connecting wire connecting to the lead, which is implanted into the deep part of the brain by a neurosurgeon using this technique called stereotactic neurosurgery. And that's the one end of the electrode, which we want it to be within this certain areas within the brain. And this is how the pulse generator or the battery device looks like, and that's the size. And finally, when all this thing is done, the neurologist like me would do or calibrate the electricity, how much current, and so on and so forth, and which contact is best suitable for patients. Now, mind you, deep brain stimulation is not suitable for everyone. We have to carefully select the patient in order for the procedure to be successful. Now, more important in patients with Parkinson's is, which I explained earlier on, was this multidisciplinary care. And now we also have community care combined with this multidisciplinary care. So multidisciplinary care involves the various allied healthcare, as well as the advanced specialist nurse, as well as the neurologist, plus the program coordinator. And that's in the hospital setting. And in the community level, we have got various community nurses as well as community care providers. All of us are trying to work together and helping the patients, and not just the patient, but also the caregiver, to for the benefit of patients to continue their care in the community setting. All right, so what does the future hold for Parkinson's disease? I feel that it's actually becoming more and more increasingly better. And that's because of there is improvement of the current therapies, there is improvement of the care deliveries, as well as there is development of novel therapies. So this is a quote by one of the Parkinson's patients Is there still a future for Parkinson's? Certainly there is, but how will it be? Well, I've got Parkinson's for 12 years, and thanks to the right medications, my life has not changed that much. Of course, there have been bad periods, and I'm sure there will be more bad days to come, but with positive mindset and support, I will remain on top of my condition. And this is the core for all patients with Parkinson's, and what we wish that all our patients would have is having a very positive mindset, as well as all the support they need to be on top of their condition at all times. All right. And so with that, I thank you for your attention.